What if your body has been warning you about a major medical emergency for months, but you have been looking at the wrong end of your body? Most people think a stroke happens entirely in the head. They look for sudden slurred speech or a drooping face. But the truth is, the earliest, most ignored warning signs often appear as far away from your brain as possible, right down in your feet. As a medical professional, I see patients dismiss these subtle changes every day. They assume it is just old age or poor-fitting shoes. Take my patient, John. He was a vibrant, 62-year-old grandfather who noticed a slight, painless change in how his slippers fit. It seemed so minor that he ignored it. Sadly, just 2 weeks later, that unaddressed blood flow problem in his feet led to a massive stroke. Today, we are breaking down the 9 warning signs in your feet that could mean a stroke is looming. Your feet actually hold the blueprint to your brain's health. By the end of this video, you will learn exactly what to look for, why these signs happen, and 3 simple actions you can take tonight to protect yourself or your loved ones. Do not ignore these flags. Let's look at the very first sign you need to watch out for. The very first warning sign to watch out for is sudden, unexplained ice-cold feet, even when you are sitting in a perfectly warm room. Shortly after this happens, you might notice the second warning sign, which I call ghost numbness. This is a strange pins and needles sensation that comes and goes in just one of your feet. Most people completely misunderstand these changes. They assume it is just a drafty house or a normal part of getting older, so they simply throw on a pair of thick socks and forget about it. But medically, this is a major red flag. This coldness and numbness often mean you are dealing with a condition called peripheral artery disease, or PAD. It can also mean a tiny microclot has formed. Think of it like a kink in a garden hose. If water stops flowing smoothly at the very end of the hose, the water pressure builds up dangerously back at the source. In your body, if fatty plaque is choking the narrow blood vessels down in your feet, it is highly likely doing the exact same thing to the major arteries leading directly to your brain. The numbers back this up, too. According to the American Heart Association, people with this type of poor blood flow in their legs have up to a 3 times higher risk of suffering a devastating stroke or a heart attack. Your body is trying to tell you that your vascular system is struggling. Fortunately, you do not need expensive medical equipment to catch this early. You can start doing a simple daily habit tonight called the temperature touch test. Every night before you go to bed, touch both of your bare feet with your hands. If one foot feels drastically colder than the other, or if it regularly feels numb, your body is sending you a warning. Do not wait for it to get worse. But what happens if you miss this early sign? Next, we need to look at how this problem escalates into something you can actually see changing on your skin. When those early signs are missed, the condition begins to worsen in ways you can easily see. This brings us to our third warning sign, the sudden loss of hair on your toes or lower feet. Right along with this, you might notice the fourth sign, which is shiny, tightly stretched skin. Many people think losing toe hair is just a funny quirk of getting older, but it actually reveals serious changes happening inside your body. When your blood flow drops significantly, your hair follicles are the very first things to die off because they lose their nutrient supply. Soon after, the skin itself starves for oxygen, which changes its texture and makes it look unusually smooth and glossy. Imagine a riverbed slowly drying up. The grass on the banks dies off first, and then the mud begins to crack and harden. That is exactly what is happening to the living tissues in your feet. This is a clear signal of advanced arterial narrowing. Your blood is struggling to fight against gravity to pump back up to your heart and brain, creating massive strain on your entire vascular network. Ignoring these visible changes is incredibly dangerous. When blood vessels become this narrow and brittle, the fatty plaque buildup inside them can easily rupture. If a piece of that hardened plaque breaks loose in your leg, it travels straight up through your bloodstream. It will keep moving until it wedges inside a tight artery in your brain, completely cutting off oxygen and causing an acute stroke. The good news is that you can take action today to help your body fight gravity. A wonderful preventative step is to elevate your feet above the level of your heart for 15 minutes every day. You can easily do this by propping your legs up on some pillows while resting on the couch. This simple trick assists your blood flow, relieves dangerous pressure on your veins, and gives your heart a well-deserved break. But while these signs are visible if you look closely, there is another hidden symptom that most people completely dismiss as bad luck or clumsiness. Let's look at that next. This brings us to a warning sign that creates a massive blind spot for millions of people. It is our fifth sign, and I call it the micro-limp or a subtle foot drop. You might notice that you suddenly start catching your toe on the edge of the carpet, or you find yourself slightly dragging one foot when you get tired at the end of the day. Almost everyone dismisses this when it first happens. It is so easy to tell yourself, I am just exhausted, I have always been a little clumsy, or my arthritis must be acting up again. But the medical reality behind a dragging foot is incredibly serious. This is often a sign of a transient ischemic attack, which is the medical term for a mini stroke. It means a tiny blockage is already occurring inside your brain, disrupting the vital neurological signals that travel all the way down to the deep nerve in your leg. Think of your body like a home with a faulty Wi-Fi connection. Your brain is the main internet router, and your foot is a device trying to connect to it. If the router starts losing its signal or losing power, the device down the hall stops responding correctly and starts lagging. That is exactly why your foot is not lifting the way it should. Your brain is struggling to send the message. To make sure your connection is working properly, you can perform a simple self-check right now called the heel-to-toe walk test. Find a straight line on your floor and try to walk along it, making sure the heel of your front foot touches the very tip of your back toe with every single step. If you find that you lose your balance significantly on one specific side, or if you realize you simply cannot lift your toes upward toward your shin, you need to take note of it immediately. This is not just everyday clumsiness, it is a clear cry for help from your nervous system. But as scary as a mini stroke sounds, ignoring these signs can quickly lead to a full-blown emergency. Let's look at how these minor foot changes can suddenly turn into a high-risk crisis. When minor nerve and blood flow issues are ignored, they can quickly spiral into a high-risk medical crisis. This brings us to our sixth warning sign, slow-healing sores or minor cuts on your feet. You might notice a simple scratch or blister that takes weeks just to form a scab. Right alongside this is our seventh sign, which is a dark or purplish discoloration of your toenails. It is easy to look at a small blister and think it is no big deal. However, when your blood vessels are clogged, your feet do not get enough oxygen-rich blood to repair tissues. That harmless blister can quickly turn into a dangerous open ulcer. In the emergency room, we call this severe stage critical limb ischemia. We frequently see these advanced foot wounds hand in hand with patients who are currently having an acute stroke. This happens because a person's entire vascular tree, the massive network of blood vessels throughout the body, is becoming brittle, clogged, and failing all at once. Medical research strongly supports this connection. Major neurological journals show a direct link between deep foot ulcers and high-grade carotid artery blockage, which is a severe narrowing of the main blood vessels in your neck that feed your brain. If the plumbing is failing badly enough to stop a scratch on your toe from healing, it means the plumbing to your brain is likely in a very dangerous state too. Because the stakes are so high, you must take urgent action if you spot these changes. If you have any kind of cut, scrape, or sore on your foot that does not show clear signs of healing within 7 days, do not wait for your next annual checkup. Call your doctor right away and request a vascular ultrasound. This simple, painless test checks the blood flow in your legs and can catch a life-threatening blockage before it ever reaches your brain. But since we have covered some heavy medical information, let's take a quick moment to pause, check in with each other, and talk about how you can use this information to protect your family. Let's take a brief breath here, because I know this medical information can feel a bit overwhelming. It is a lot to take in, but learning these details is the most powerful tool you have to protect your health. Take a second right now to look down at your own feet, or think about the habits of your spouse or parents. Have you noticed any of these changes lately? Are your feet constantly freezing, even when you wrap them in blankets? Do you or a loved one tend to trip over flat surfaces more than you used to? I want to invite you to join our community conversation. Drop a comment below with your age and let us know if you have ever experienced that sudden, unexplained pins and needles feeling in your feet. By sharing your story, you might help someone else realize that they are not just getting older, they might actually need to see a doctor. Reading through the comments can help all of us realize we are not alone in managing our health as we age. If you found this information eye-opening, or if you have a parent, sibling, or friend over 50, please hit that share button right now. It only takes 5 seconds to send this video to them, and it truly could save a life today. When we look out for one another, we build a safer, healthier community. Now, we still have 2 more critical warning signs left to cover, including one subtle physical sign that most people completely miss until it is too late. Let's move into the advanced stages of this condition so you know exactly how to spot the deepest, hidden warning signs before the sun goes down tonight. Now that we are back, let's look at a symptom that signals advanced damage inside your blood vessels. This brings us to our 8th warning sign, a severe, burning foot pain that gets worse only at night. You might feel perfectly fine while walking around during the day, but the moment your head hits the pillow, your feet start to throb, ache, or burn. In the medical world, this represents something called ischemic rest pain and advanced nerve damage. It is a sign that your blood vessels are so narrow that your tissues cannot get enough oxygen even when you are completely resting. But why does this pain get so much worse at night? It all comes down to basic physics. When you stand or sit during the day, gravity helps pull blood down into your legs and feet. But when you lie completely flat to sleep, you lose that extra help from gravity. Blood has an even harder time reaching the furthest points of your body, which are your toes. Because they are starving for blood, the tiny nerves in your feet literally start screaming for oxygen. Think of it like turning off the main water valve to a backyard sprinkler system. The sprinkler heads closest to the house might get a few drops of water, but the furthest sprinkler heads down by the fence stop spraying entirely. Instead, they just hiss and sputter. That painful burning in your toes is your nervous system huffing and puffing because the flow has been cut off. Thankfully, you can make a few quick lifestyle corrections tonight to get some relief and protect your vessels. First, try sleeping with the head of your bed slightly elevated or use a supportive wedge pillow. This keeps your upper body raised just enough so gravity can keep assisting your blood flow while you rest. Second, make sure to avoid tightly tucked bed sheets. When sheets are tucked in too tight at the foot of the bed, they force your toes to point straight downward all night, which pinches your blood vessels and restricts flow even further. But we have one final, incredibly quiet warning sign left to cover, and this one involves an unexpected change in just one of your ankles. Let's look at that right now. This brings us to our 9th and final warning sign, which is one of the quietest indicators of danger in the entire body, asymmetrical foot swelling. This simply means that one of your ankles or feet looks noticeably puffier, larger, or more swollen than the other one. Many people get swollen feet from time to time, especially after a long day of traveling or standing. But when both of your feet swell up at the exact same time, it usually points to a general issue with your heart, kidneys, or liver. One-sided swelling, however, is a completely different story. When only one foot or ankle puffs up, it is a classic hallmark sign of a deep vein thrombosis, which is a dangerous blood clot hidden deep inside the veins of your leg. You might wonder how a blood clot down in your leg can cause a stroke up in your brain. If that hidden clot breaks free from the leg vein, it travels up through your bloodstream and straight into your heart. For many people, a common and completely undiagnosed heart feature allows this clot to cross over to the wrong side of the heart. This feature is a tiny, hidden hole in the heart wall called a PFO. Instead of the clot getting safely trapped and filtered out by your lungs, it slips right through that tiny opening and shoots straight up to your brain. This triggers a sudden and dangerous event called a paradoxical stroke. Because a hidden clot can move quickly, you need a way to check for it at home. You can do this right now using a simple method called the tape measure test. Take a flexible measuring tape and wrap it around the widest part of both of your calves, one at a time. If you find that one calf is more than 3 centimeters larger than the other one, especially if that leg also feels warm to the touch, looks red, or feels tender when you squeeze it, do not wait. Go to an urgent care clinic or an emergency room immediately and ask for a venous duplex scan. This quick ultrasound can spot the clot before it ever has a chance to move. Now that you know all 9 hidden signs, let's look at exactly what you should do next to keep yourself completely safe. Remember, your body rarely remains silent before a major medical event. It warns you early, and those warnings often start at the very bottom, right down in your feet. But I want to give you some important reassurance here. Spotting any of these 9 signs does not mean a devastating stroke is inevitable. When you know what to look for, these conditions can absolutely be managed, treated, and even reversed. You can take charge of your health starting right now with a very simple immediate action plan. Tonight, before you go to sleep, perform the temperature touch test on both of your feet. Tomorrow morning, take a few moments to test your balance with the heel-to-toe walk test. If you notice that something feels off, or if you spot any unusual skin changes or swelling, do not panic. Simply schedule a routine appointment with your doctor and ask them for a thorough vascular assessment. Catching a problem early changes everything. Protecting your blood vessels is about so much more than just avoiding a hospital bed. It is about keeping your independence for years to come. It means staying active, playing tag with your grandkids, and enjoying the high quality of life that you truly deserve. You have the power to protect your future just by listening to what your body is trying to tell you today. If this video opened your eyes and helped you understand your body a little better, please subscribe to the channel for more simple, doctor-led health guides. Hit that like button to help other people find this important information, and make sure to share it with someone you deeply care about. Stay proactive, listen closely to your body, and I will see you in the very next video.